Good afternoon, everyone. Myself, Dr. Shweta Sonwalkar, Clinical Head and Fertility Specialist at Oasis Fertility, Belagavi. So today I will be discussing regarding thin endometrium. So before going into thin endometrium, let us understand the layers of the uterus, that is anatomy of the uterus. Uterus has got three layers. That is, outermost layer is known as perimetrium. Middle layer is known as myometrium, which is made up of muscle fibers, and innermost layer is known as endometrium. Again, in endometrium, it is divided into two layers. That is stratum functionalis, which is the functional layer of the endometrium, and this layer changes in response to ovarian hormonal cycles. And this is the layer which is shed during the menstruation. And one more is stratum basalis, which is the deep basal layer of the endometrium. And after shedding of the endometrium during menstruation, this stratum basalis forms a new functionalis layer. And this layer is unresponsive to ovarian hormones. So these are the two layers of endometrium. This slide is showing stratum basalis and stratum functionalis. So let us understand the menstrual cycle. This menstrual cycle contains two phases. First is follicular phase. Follicular phase, it lasts from day 0 of the menstrual cycle to ovulation. That is day 14 of the menstrual cycle. And during this period, follicular stimulating hormone FSH, it is secreted from the pituitary and it acts on the ovary to form the follicle, and the follicle starts growing in the size. And at the same time, endometrium starts increasing in the size. And once day 14 of the cycles, ovulation will occur. Once the ovulation happens, then endometrium starts secretory changes because of the progesterone hormone which is secreted from the ovary. Therefore, the normal endometrium during the menstrual phase, that is from day 1 to day 5 of the menstrual cycle, the thickness is approximately less than 4 millimeter. And during the proliferative phase, that is from day 6 to day 14, it should be around 4 to 8 mm. And in the secretory phase, it should be up to 12 millimeter to 16 mm. But adequate growth of this endometrium, it is an important factor for successful implantation and pregnancy outcome. The measurement of endometrial thickness is most commonly it is used as a prognostic factor for the pregnancy when we are treating the patients. And endometrial junction, it is directly correlated to increasing circulating hormone, that is estrogen hormone. So any permanent damage to the basal endometrium may occur due to severe endometritis or due to vigorous curettage following the abortion. And persistent thin endometrium should always be evaluated for latent tuberculosis, as incidence of genital tuberculosis is very high in India. So for all practical purposes, completely damaged basal endometrium cannot be regenerated. So what are the causes which causes thin endometrium? Thin endometrium as such means less than 7 millimeter is called as thin endometrium. So why it happens? There are many causes like low estrogen levels. Low estrogen levels in the body may be because of prolonged use of clomiphene citrate, which is used during ovulation induction cycle. If we continuously use for 4 to 5 cycles, the estrogen levels will fall and the endometrium becomes thin. And even prolonged use of combined oral contraceptive use for a long time temporarily causes thin endometrium. Then genital infections like genital tuberculosis, then chronic bacterial infections, sexually transmitted diseases, pelvic inflammatory diseases. These all causes of thin endometrium. These all sometimes causes scarring in the endometrium, and other causes like previous surgeries, like DNC and surgeries for fibroids or adhesions. They damage the endometrium. If the damage is present in the basal layer, endometrial layer, then it causes permanent thin endometrium. That is, which cannot be regenerated again. Then hormonal imbalances, as in case of PCOS cycles. Then poor blood flow, which is due to smoking or obesity, high blood pressure, diabetes patient, and again number control pills. These all cause poor blood flow to the endometrium, which again causes thin endometrium. Then premature ovarian insufficiency, again hormonal imbalance will be there. That is a decrease in the estrogen content in the body. Then patient undergoing radiation and chemotherapy. So these are all the causes for thin endometrium. These all affects implantation, like a high resistance in the radial arteries, which causes poor growth of the glandular epithelium and decreases the vascular endothelial growth factor expression. So poor vascular development causes decrease in the blood flow in the radial arteries, leading to thin endometrium. So the symptoms the woman has in thin endometrium are, yes, she might present with irregular or light periods. If periods become lighter or more irregular than usual, it can signify a thin endometrial lining. Then patient might come to us as a infertility, inability to achieve a pregnancy. Then there is inadequate bleeding during the menstrual periods. Many times there may be no symptoms of the thin endometrium. So treatment, first step is find out the cause as mentioned earlier, and diagnosis of thin endometrium is mainly by transvaginal ultrasonography, mainly during the 11th or 12th day of the menstrual cycles. The transvaginal ultrasonography is done, and measurement of the thickness of the endometrium is taken. Then color blood flow studies are done. Then 3D or 4D ultrasound to rule out any polyp or any fibroids. So the causes of the thin endometrium can be ruled out by 3D ultrasound. And hysteroscopy is done to rule out endometritis and any infection in the endometrial cavity can be ruled out by doing hysteroscopy. So what the treatment to improve the thickness of the endometrium is by one is by hormonal therapy. That is any deficiency in the estrogen levels in the body can be supplemented with estrogen estrogen supplementation either by tablets or injectables or patches or in the form of gel. Then endometrial scratch, it is a minor procedure where the endometrial lining is gently scratched to stimulate the growth factors. Then nutritional supplements, certain supplements like L-arginine and vitamin E, they improve the endometrial thickness. Then lifestyle changes, a healthy diet, regular exercises, and reducing the stress can positively impact the endometrial health. And other treatments like GCSF, that is granulocyte colony stimulating factor. This is a preparation, injectable preparation. It increases the blood supply to the endometrium and it supplies growth factors to the endometrium. and improvement in the thickness of the endometrial thickness is seen with GCS. And platelet-rich plasma, and it is derived from the woman's platelets, and it has got many growth factors which enrich the endometrium and makes it more receptive. So this PR, it is also known as, in short, PRP. It can be given sometimes even by hysteroscopic subendometrial injections, or or in the form of flush. So these GCSF and PRP installation both has seen to increase the thickness of the endometrium. Thank you. What treatments are available for a thin endometrium? So thin endometrium, first we have to rule out the cause. According to the cause for the thin endometrium, like if the cause is only deficiency in the estrogen hormones, then we can supplement with the estrogen supplementation in the form of tablets, gels, or injectables. Or if the cause is any genital infections, then we have to do hysteroscopy and treat the causes like endometritis or genital tuberculosis. And accordingly, treatments are given in the form of supplements, then GCSF and PRP installation. They help to improve the thickness of the endometrium. Can lifestyle factors and stress impact endometrial health? Yes, lifestyle factors like lifestyle factors and stress. It impacts the endometrial thickness, and accordingly, the treatment like lifestyle changes, like the control in the diabetes, then obesity. We have to ask the patient to reduce the weight, and also BMI should be under control, and even smoking, to quit the smoking. So lifestyle changes, it definitely impact the endometrial thickness, and patient should be aware of that, and undergo the whatever doctors advise. They have to follow it to improve the thickness of the endometrium. What dietary changes can support the endometrial health? Dietary changes like uh, uh, patient can go for uh, balanced food which are enriched in taking medications which increases the blood supply to the endometrium, and uh, supplementation. We can give like vitamin E. Even vitamin E increases the uh, blood supply and improves the thickness of the endometrium. Thank you.